It all started one day when I was operating on a relatively soft cataract and I was in a mood to experiment on the capabilities of my Phaco machine. Not to mention that I was showing off to my residents watching my surgery. Patient was on topical anesthesia, 2.2 mm clear corneal tunnel incision, good dilatation, good capsulorhexis, good hydrodissection and hydrodelineation, and using enough viscoelastic. I assessed the cataract for a couple of seconds with the Phaco tip in the eye. Notice that there is a central core that is relatively firm and the rest of the peripheral cataract is very soft. I delineated the central core doing a circular ring Phaco, emulsified the central core, and the rest of the cataract is removed easily. All this could be accomplished without a second instrument or side port incision and with a single hand. This emboldened me to try to do a single hand Phaco in a slightly denser cataract. I noticed that the simple delineating with the ring Phaco is not enough as the cataract is more dense, and so I have done a regular trenching. I have noticed that it is a grade 2 to 3 cataract. With the urge to do a single hand Phaco combined with the enthusiasm to develop a new technique, I rotated the nucleus without the help of my second instrument. As the cataract is dense, I was not able to progress well with the surgery. Not willing to give up, I have decided to attack the lens at its weakest point, the periphery of the lens. I created a wedge defect at the equator of the lens, rotated the cataract, and repeated the same at a different place. This gave me room to manipulate the nucleus and I could get a good hold of it, but it is still a big chunk and need to be broken down into smaller pieces. This is when I have done a sweeping horizontal motion right in the center of the bulk of the cataract, breaking it at the pupillary plane. The rest of the cataract removal was simple. I could achieve single hand Phaco, but not exactly to my liking, and I decided to improve on it and tried the same in many subsequent cases. This is when I put my mind on how to break this cataract and how to use that horizontal sweeping motion in a more refined way. After many similar Phacos, I have designed one more of my techniques, the Ninja Chop. Ninja Chop is achieved by creating a wedge defect at the periphery of the lens, catching hold of the nucleus adjacent to the edge defect, lifting the edge of the nucleus and using the horizontal sweeping motion to cut the cataract in the pupillary plane. Repeating the same gave me smaller pieces of cataract without the use of a chopper or a second instrument, and the Phaco is completed comfortably. As I was dealing with more denser cataracts, I started debulking the cataract centrally, and now that I know that the weak point of the cataract has to be attacked first, I did not waste time and went straight for it. I have realized at this point that Ninja Chop itself is not sufficient for such cataracts, and I used another of my technique that I have developed for hard cataracts, where I can access the posterior plate of the cataract at the pupillary plane, the Phaco somersault. Phaco somersault is a way to flip the nucleus 180 degrees to access the posterior plate of the nucleus anteriorly at the pupillary plane. With a combination of Ninja Chop and Phaco somersault, I could achieve single hand Phaco with ease in the pupillary plane, achieving clear corneas postoperatively. I have tried single hand Phaco in all types of routine cataracts, making sure that there is good dilatation and intact zonules, and also started to try on difficult cataracts like this mature cataract. Capsulorhexis can be accomplished through the main incision, a double ribbon rhexis in this leaking mature cataract. These mature cataracts with the liquid cortex are very difficult to deal with, as there is absolutely no support for us to rely on in the absence of the epinuclear cushion. However, I have applied the same principles of using ninja chop and Phaco somersault and was successful in completing the surgery without any event. All steps of the cataract can be done with only a single hand without using the side port. Capsulorhexis and nucleus rotation have already been seen in previous cases. Epinucleus removal, cortical cleaning, and a posterior capsular polishing are done using a coaxial irrigation handpiece which does not require the second hand. IOL implantation of a single piece IOL can be accomplished with ease through a 2.8 mm or a 2.2 mm incision comfortably. IOL implantation of a 3-piece IOL through a 2.8 mm incision can also be achieved with a little practice. Single piece IOL implantation is easier than the 3-piece IOL implantation. Viscoelastic removal in the anterior chamber and under the IOL is done without any trouble. In my routine practice now, I do almost 80% of my cataracts with this single hand using ninja chop and Phaco somersault techniques and deal with all types of cataracts. So what have we achieved with this single hand Phaco? The free hand available can be used to design other techniques and instruments for cataract surgery. And this is an excellent opportunity for surgeons, innovators, and equipment companies to refine on this technique, stretch their imagination, and invent new equipment to aid in our cataract surgery. Thank you very much.